for the inauguration event of Liver Transplant Unit and Robotic Surgery. I also extend my warm welcome to our Member of Parliament of Bhubaneswar, Shri J.P. for her esteemed presence here at AIIMS for the inaugural event that proves her commitment and dedication for the AIIMS as a member of IB and GB. I also extend my warm welcome to Honorable Secretary of Health and Family Welfare, Madam Salila Srivastava, who has been always a strong driving force for the accomplishment of this landmark achievement. I also welcome Joint Secretary Ma'am Ankita Mr. Bundela, Ministry of Health and Family Welfare for this inaugural event, who has been instrumental in the Health Ministry for her dynamic and constant effective support for the rapid development and transformation of AIIMS to an institute of excellence in patient care, teaching and research. It gives me an immense pleasure to welcome our Institute President, Madam Professor Anita Saxena, for inaugural event, who has always been contributing towards the positive development and enrichment of the AIIMS. I also welcome all the dignitaries and the members of IB and GB joining online for this inaugural event. I also take the opportunity to welcome all members of the AIIMS family for this inaugural event. आज एम्स भुवनेश्वर केवल एक अस्पताल नहीं बल्कि पूर्वी भारत के करोड़ों लोगों के लिए अत्याधुनिक चिकित्सा का नया केंद्र बनकर उभर रहा है। माननीय मंत्री जी के विजन और हमारे चिकित्सकों के अथक परिश्रम एवं प्रयास से हमने स्वास्थ्य सेवा के दो ऐसे शिखरों लीवर ट्रांसप्लांट और रोबोटिक सर्जरी को छुआ है जो अब तक इस क्षेत्र के लिए एक सपना था। Under the visionary leadership of our Honorable Health Minister, we are moving close to the goal of Swasth Bharat, Viksit Bharat. Our commitment to this vision is already evident to our successful renal and the bone marrow transplant services, which operate strictly under the NATO guidelines. Our state-of-the-art ICU facilities and our specialized brain death committee ensures that the gift of life through the organ donation is handled with the utmost urgency and ethics. On February 23, 2024, AIIMS Bhubaneswar achieved a landmark by retrieving the multiple organs from a cadaveric donor, which were then transported across India to save lives. Today, we take the momentum further. I am proud to announce that we are now fully prepared to launch our liver transplant facility, a critical addition that will strengthen our transplant program and offer a new hope to patients across the region. A healthcare becomes increasingly intertwined with the technology. AIIMS Bhubaneswar remains at the cutting edge. With this gracious support of the Ministry of Health and Family Welfare, we have procured a sophisticated robotic surgery system. This high-tech and advanced will integrated across multiple surgical disciplines. Sir, your support has been the catalyst for this advancement. As you inaugurate these services today, you are not just opening a wings of the hospital, you are opening a new chapter of medical excellence in India. Once again, I welcome all the dignitaries and delegates to this inaugural program. Jai Hind, Jai Bharat.
I would now request Dr. Anita Saxena ji, President AIIMS Bhubaneswar, to kindly give an overview of the Liver Transplant Unit and the Robotic Surgery System. Over to you, ma'am.
Thank you. The Honorable Minister of Health and Family Welfare and Chemicals and Fertilizers, Government of India, Shri Jagat Prakash Nadda ji, Honorable Member of Parliament, Ms. Aprajita Sarangi ji, Secretary, Ministry of Health and Family Welfare, Ms. Punya Salila Srivastava Madam, Joint Secretary, Madam Ankita Mishra, other dignitaries on the dais at AIIMS Bhubaneswar and here in the room, and those who have joined online. Dr. Ashutosh Biswas, Executive Director and CEO, AIIMS Bhubaneswar. It is with immense pleasure and gratitude that I would like to introduce two new facilities which will be inaugurated shortly by the Honorable Minister, Sir, at AIIMS Bhubaneswar, both of which are going to be of great benefit to the patient population, not just in Orissa, but in whole eastern part of India, as Dr. Biswas said. Thank you, sir, and ministry officials for approving these projects. So let me just begin with the facility for liver transplantation. In fact, liver transplantation is one of the more difficult solid organ transplants compared to many other. We are really very grateful to you, sir, and to the ministry for providing the guidance and strategic leadership so that this program could start at AIIMS Bhubaneswar. Just to give a brief background, the journey began in 2023 with detailed planning, infrastructure development, training of the team, and regulatory compliance. Proposal was approved in the SFC in January 2023, and the dedicated liver transplant clinic started in February 2025. Liver transplant license was received by AIIMS in October 25, and I visited this 10-bedded dedicated transplant ICU and transplant OT, which was established by November 2025. As we all know that any transplant would need a donor and a recipient. So AIIMS Bhubaneswar started organ donation program in February 2024, and this really allowed organ retrieval capabilities. And in fact, they retrieved liver successfully a long time ago, which was safely flown to ILBS New Delhi. And this was really an important step for liver transplantation program in AIIMS itself. So the first liver transplant was successfully performed on 20th December 2025. It was conducted on a 37-year-old man from Puri. Donor was his younger brother. The surgery was performed by a team of almost 50 healthcare professionals, which was led by Dr. Brahmadatta Patnaik, who is head of the program. And the surgery lasted for about 14 hours. I'm really indebted to the team at ILBS, Institute of Liver and Biliary Sciences, New Delhi, specifically Dr. Vinendra Pamicha and his team for providing crucial mentorship and technical support. The second liver transplant was done later on a 46-year-old man, his wife being the donor. And I'm happy to say that both these cases have done well, and the donors are also doing well, which is also a very important part of the program. So a dedicated liver transplant clinic is running currently every Tuesday afternoon, and there are many more on the waiting list, and hopefully the numbers will start increasing soon. AIIMS is actively collaborating with the organization that is SOTO and NOTO, which are very necessary for any transplant program. AIIMS Bhubaneswar is also conducting awareness programs to promote organ donation and educate public about transplantation. And as most patients are likely to face financial challenges, I think patient treatment is facilitated very well by AIIMS through Ayushman Bharat and Rashtriya Arogya Nidhi programs of the Government of India. A brief about the second facility, which is very recently installed, that is a robotic surgery system. So this system enables really precise, complex procedures, and a lot of surgical procedures like prostate removal and some gynae procedures and some oncology procedures can be done with a very small incision with less blood loss and a very short hospital stay. So it's good for the patient as well as for the hospitals. We can treat many more patients. So this was duly approved in SFC earlier, and on 2nd January 2026, AIIMS Bhubaneswar received this latest state-of-the-art Da Vinci robotic surgical system with dual console and an incorporated simulator. Installation started on 3rd January and has been completed within a week. In fact, training of the surgeons is also, to some extent, has been initiated and completed also. I'm told that the faculty is ready to perform its first case very soon. So this is really the most advanced version and the first one in government medical institution in Eastern India. So I'm sure the availability would be a significant boon for the population of Eastern India. And thanks very much again to the Honorable Minister and other health officials. We hope to bring many more such facilities to AIIMS Bhubaneswar in future with your support. Thank you very much, sir.
Thank you, ma'am. I'll now request Honorable Minister, sir, to kindly inaugurate the liver transplant unit by pressing the button. I would once again request Honorable Minister, sir, to kindly inaugurate the robotic surgery system by pressing the button.
ऑडियंस को हमको
बचा।
ऑडियंस को दिखाना चाहिए
So that the audience can see that. They have it there also. Physically. Now request Secretary Health and Family Welfare to kindly share her views on this inaugural function.
Honorable Health and Family Welfare Minister Shri J.P. Nadda ji, Honorable Member of Parliament Srimati Aparajita Sarangi ji, Dr. Anita Saxena, Dr. Ashutosh Biswas, members of IB and GB, faculty and students of AIIMS Bhubaneswar, my colleagues Ankita and Sanjay and their teams. It is a matter of great pride that we have gathered here today to celebrate a remarkable milestone in the journey of AIIMS Bhubaneswar. And I think what is remarkable is that AIIMS Bhubaneswar is observing a very holistic approach, as has been brought out by Dr. Anita Saxena ji. And this is, I think, for this, I would like to congratulate AIIMS Bhubaneswar and the entire team. As all of you are aware, it has AIIMS Bhubaneswar is one of the AIIMS established under Pradhan Mantri Swasthya Suraksha Yojana with the vision that it will be a true center of excellence, providing advanced tertiary care, promoting pioneering medical research, and nurturing high quality academic programs. With an average daily footfall of nearly 5,000 patients, AIIMS Bhubaneswar has indeed become a trusted healthcare destination and a beacon of hope for people in Eastern India. And with today's with the facilities that have been inaugurated today, I'm sure we are moving rapidly towards fulfillment of our vision for AIIMS Bhubaneswar. I would also like to observe that these life-saving procedures are being facilitated under the Pradhan Mantri Jan Arogya Yojana and Rashtriya Arogya Nidhi. Therefore, we are ensuring that economically disadvantaged patients receive transplantation and comprehensive care without financial hardship. Sir, this unit is also a valuable addition in the health infrastructure of our entire country for facilitating organ transplant. Under the leadership of Honorable Minister, we are observing this year as Angdan Jeevan Sanjeevani Abhiyan. And this transplant unit can and will be a Jeevan Sanjeevani for many patients. Honorable Prime Minister has also time and again been emphasizing the importance of young Angdan, and he has been felicitating the organ donors through Man Ki Baat. I'm sure with his inspiration, people will come forward for organ donation and to support organ donation, and such units will ensure that the goal of our organ transplantation is achieved. I wish good health to all of us and all of you, and together, I'm sure we will achieve our goal of Swasth Bharat, Viksit Bharat. Thank you.
Thank you, ma'am. I would now request Honorable Member of Parliament, Srimati Aprajita Sarangi ji, to kindly share her views on the occasion today. Over to you, madam.
Honorable Shri Nadda ji, Minister, Health and Family Welfare and Chemicals and Fertilizers, Government of India, Madam Shivastava, Secretary to Government of India Health and Family Welfare Ministry, Madam Professor Anita Saxena, Executive Director Dr. Ashutosh Biswas ji, AIIMS Bhubaneswar, all esteemed members of the IB and the governing body of AIIMS Bhubaneswar, the doctors present here, and all the staff who are here to encourage all of us. It's indeed a matter of pleasure and privilege for me as a member representing in the Lok Sabha to be part of this just event here within the premises of our AIIMS. Friends, we are well aware of the fact that AIIMS Bhubaneswar is a pre-medical institute, and since 2012 till date, it has been growing by leaps and bounds. This is definitely an example for all other AIIMS. We are talking of 22, 23 AIIMS in the country. The number is increasing rapidly everywhere in the country, and this is definitely an example for other AIIMS to follow. We are well aware of this. This particular AIIMS, since I'm closely associated with the functioning, being the member of the governing body, I can say with all conviction at my command that this particular institute, seeing one milestone after the other with every passing day, and it's doing great work as far as healthcare is concerned, as far as medical education and research is concerned. Friends, I really feel proud. Once again, I say that I'm part of this momentous occasion. The liver transplant journey of Bhubaneswar is a testament to the dedication, spirit of collaboration, the desire to achieve excellence in public health care. Now imagine October 2023, the state government gave the transplant license to AIIMS Bhubaneswar. And the first organ transplant was done by this institute, this premier medical institute, in December 25. And since that particular date till date, since 23 till date, there have been 5 organ donations and 2 liver transplants. And we are well aware of the fact that this particular medical institute, AIIMS Bhubaneswar, boasts of 1,028 beds, 4,000 doctors and paramedical staff, and 42 very specialized departments. And there is load of patients. We keep coming across patients, and the best part is that there is always patient survey, the satisfaction level of the patients going up with every passing day. And I must compliment and commend the efforts of all those who are associated with the working of this premier medical institute in Bhubaneswar. This particular medical institute is certainly, as the secretary said, a beacon of hope for the eastern region. It has been building lives, saving lives, and kind of reaffirming our faith in teamwork. And my dear friends, 2 big things are being done today. And all of us need to sincerely thank our Honorable Minister, Shri Nadda ji, for having spared his time for being with us and for inaugurating the Liver Transplant Unit and the Robotic Surgery System. We are talking of advancement in healthcare. We are talking of technology-driven healthcare. We are talking of more and more innovations. Don't you think this entire initiative aligns with our Honorable Prime Minister's vision of world-class, innovation-based, and technology-enabled healthcare? We are trying to provide accessible healthcare, affordable healthcare, technology-driven healthcare, and quality, very high quality healthcare to all, everywhere in the country, to 1.4 billion people. And I'm delighted, again, I would say, as the member of parliament representing this particular constituency in the Lok Sabha, of having this particular institute located in Bhubaneswar. Now, I was just talking to the doctors, and the doctors informed me that there is a huge list of patients awaiting liver transplants. And the executive director just informed that in the days to come, there would be doctors who would be sent for robotic surgery training. So I think this is just the beginning. And we look forward to a lot of good work in these 2 sectors in the future. I would also like to inform our minister that there are 2 donors who are sitting here who are very much part of the crowd. And before we started the discussion here, the 2 donors, our esteemed donors, had come onto the stage. We for them for having shown the courage. So they are very much here. And once again, commend the efforts of everybody who have tried to translate our dream into reality. We look forward to listening to Honorable Minister Shri Nadda ji, and we definitely look forward to his guidance. Thank you so much. I can only say, I'll end with 2-3 lines. Since 2012, and we are into 2026. So many years have passed, a lot of water has flown down the Ganges, but three lines definitely before I conclude. Good, better, best. Never let it rest till your good is better and your better best. So we have to move from good to better and better to best. Let's all aspire to make this institute, this AIIMS Bhubaneswar, the best AIIMS in the country. And with the support of our Honorable Minister and the very able officials in the Ministry of Health and Family Welfare and in the state government, I'm sure we can do it together. Thank you so much.
Thank you, ma'am, for your words and your message of exhorting everybody to move towards becoming the best. Now I will request Honorable Minister, sir, to kindly address the gathering.
Ms. Aparajita Sarangi, the Member of Parliament, and my colleague in the Parliament, Lok Sabha, Ms. Punya Salila Srivastava, the Secretary, Health and Family Welfare, Government of India, Dr. Anita Saxena, the President of All India Institute of Medical Sciences, Bhubaneswar, Ms. Ankita Mishra Bundela-ji, the Joint Secretary, Ministry of Health and Family Welfare, Dr. Asutosh Viswas, Executive Director, All India Institute of Medical Sciences, Bhubaneswar, members of the GB and IB, officers from the ministry, teams from the All India Institute of Medical Sciences, Bhubaneswar. It is really a very happy moment and a momentous moment and momentous occasion when I got the opportunity to inaugurate the liver transplant facility in All India Institute of Medical Sciences, Bhubaneswar. Commissioning of the surgical robotic system also. It's a historical milestone and a proud moment for all of us. We all know that institution has rapidly developed into a center of excellence, providing comprehensive tertiary care, pioneering in the medical research and high quality academic programs. This institute has been successfully in performing kidney and bone marrow transplants. And now I'm happy to note that a new chapter of liver transplant facility has also been added. Yesterday in the Mann Ki Baat, Prime Minister Modi ji has talked about organ donation. And he emphasized that we should sensitize people about organ donation and see to it that more and more people come forward and make this a movement. And certainly the very next day, when the AIIMS Bhubaneswar facilitates with the liver transplant facility, I think it is a welcome step, and it is a step which we should see that it is in sync with the ideas and the direction given by Honorable Prime Minister. The new liver transplant facility is a step forward for the noble cause. I congratulate the entire team of All India Institute of Medical Sciences, Bhubaneswar, for this achievement. It is a happy moment that institute established the state-of-the-art of liver transplant operation theatre and ICU, with all modern medical equipments. This liver transplant specialty clinic, the post-transplant follow-up, and the continuity of care, all this has been taken care. So really, it's a very good news for us that we are going forward in this direction. The liver transplant facility brings advanced and a world-class life-saving treatment and the stage liver disease. Certainly, the patients from the eastern India, from Orissa, even from parts of Bengal, parts of Assam, they are going to get the benefit of this facility, and it is going to benefit the economically marginal section of the society, the weaker section of the society. and they will not have to face the hardships. So I'm also told that the two liver transplant has taken place. So it's a welcome step that two liver transplants have taken place and both the patients are recovering well, leading to normal lives. So this shows how we are going forward. I would also like to congratulate, because this is the result of the hard work of the surgical gastroenterologists also, the nurses also, the technicians, the support staff who has ably done these two operations, and they are going forward. So I congratulate them. With the commissioning of the state of the art of the surgical robotic system, certainly it's a very welcome step. And AIIMS Bhubaneswar will be the first government institution, the first government facility in Odisha with a comprehensive robotic surgery program. Operationalization of a surgical robotic system. This will ensure delivery of affordable, technology-driven, and minimally invasive surgeries, setting a benchmark to the public healthcare system. Robotic surgery program will also cover a wide range of surgeries, including urology, gynecology, pediatric surgery, and other types of surgeries. I'm confident that the robotic surgery program will improve the surgical precision, reduce blood loss, shorten the hospital stay, and facilitate faster recovery, and minimize the travel outside the state, such as advanced procedures. Installation of the surgical robot reflects the broader vision and integrate the advanced technology into the public healthcare. I wish All India Institute of Medical Sciences all success, and I call upon all the faculty and the non-faculty staff to continue with the dedication which they have been working for the past more than a decade and deliver patient-centric healthcare. Once again, I congratulate all of you for this momentous and very historic occasion. ये ऐतिहासिक इसलिए है क्योंकि आज के बाद हम सब लोग लिवर ट्रांसप्लांट को एक डे टू डे लाइफ के तरीके से एम्स भुवनेश्वर में देखेंगे. So I once again congratulate all of you and thank you for giving me a patient hearing. Thank you.
Thank you, sir, for your inspiring and encouraging words. As we come to an end of this session, I would now request Executive Director, AIIMS Bhubaneswar, to kindly propose the vote of thanks.
Ma'am, on behalf of the entire AIIMS Bhubaneswar family, I wish to express my deepest and the most heartfelt gratitude to our Honorable Health Minister Shri J.P. Nadda ji. And also, I would like to thank the two donors. Please come on. So they have donated this. So I'd like to thank also the younger brother who has given the liver to his elder brother, and he's absolutely fine. And also, I'd like to also thank you for the wonderful the program that going on for them only. And also, I'd like to invite for the second donor that she has she has given her liver to her husband for giving her life. Thank you very much. Thank you very much. So with this, it's a really great moment for us. Sir, it is your inspiration and the dynamic leadership that has served as the catalyst for this transformation. Your unwavering support and the strategic guidance have been the cornerstone success. Gracious presence here does more than just enhance the dignity of this ceremony. It serves as a powerful validation of our mission. It reinforces our commitment to integrating the modern medical excellence with the cutting edge med tech, ensuring that the people of this region receive world-class care and support. We are truly embodying this your brief and your potential to lead India towards a healthcare resilient future. I wish to express my deepest and the most heartfelt gratitude to our Bhubaneswar Shri Aparajita Sadengiji and also Honorable Secretary for the Health and Family Welfare, Madam Punya Salila Srivastava, Joint Secretary, Ma'am Ankita Mishra Bundela Institute President, Ma'am Professor Anita Saxena, and other members of the IB and GB of AIIMS Bhubaneswar. I also wish to extend my profound and boundless gratitude to entire AIIMS Bhubaneswar family, senior officials, visionary faculties, dedicated doctors, nurses, staff, and other administrative personnel. This successful establishment of this advanced facility for liver transplant to robotic surgery is not the achievement of one, but the triumph of many. It is a testament to our unwavering dedications, technical brilliance, and the seamless teamwork that defines our institutions. I firmly believe that this initiative of liver transplant and robotic surgery will not only mark a new milestone in the field of medicine, but will also bring a new hope, renewed the faith, and the dream of the life to countless families. With this spirit of service, we shall continue to move forwards towards the excellence. With this positive outlook and confidence, once again, thank you all. Thank you very much. Jai Hind, Jai Bharat. I think he's the donor. He has donated the liver to his elder brother. So you'd like to express his feelings and his, you know, the inner love and affection towards his elder brother. See, and given the liver to his elder brother and also life. So you'd like to express something, yeah, please.
Good evening, doctors. Today I stand here with deep gratitude and immense respect for you. It's not enough to express how thankful I am for what you have done. A liver transplant is not a surgery, it's a second chance at life. It demands extraordinary skill, precision, patience, and courage. For us, it was one of the most emotional and fearful moments for our life. For you, it was responsibility you carried with confidence and dedication. The surgery lasts many long hours, but your focus never wavered. Your steady hand and brilliant mind turn a critical situation into a successful outcome. Because of you, a family got a hope back. Because of you, lives continue. Beyond your medical expertise, what truly makes you special is your compassion, the reassurance you give before the surgery, the calm smile after the operation, and the continuous care during recovery meant everything to us. Doctor are called often lifesaver, but that title feels truly real. But you didn't just treatment a patient; you restored dream, strength, and future possibilities. From the bottom of our hearts, thank you for all your dedication, your humanity, and your excellence. Thank you so much. I would like to thanks Dr. Brahmadev Patnaik sir, Asutosh sir, Pamecha sir, Dr. Tanmay sir, Sunita ma'am, Manas sir, Sritam sir, Shiva sir, Fawa sir, Suha ma'am, Santanu sir, and all the team. Thank you.
Bye bye. Dipado Konto.
Photograph,
Yes.
both of you. And your photo.
Requested.
Yes,
Just
please.
1 second, 1 minute, please, 1 minute. Have a
Abhijit, come here. You come here.
Yeah.
You speak.
धन्यवाद समस्तु और एम्स स्टाफ और
ଏବେ କେମିତି ଅଛନ୍ତି?
ଭଲ ଅଛି
କିଛି ଅସୁବିଧା ନାହିଁ?
କିଛି ଅସୁବିଧା ହେବି ନାହିଁ।
ଯେତେବେଳେ ଲିଭର ଦଉଥିଲେ ଆପଣଙ୍କ ହଜବେଣ୍ଡ କୁ କଣ ମନକୁ କଣ ଭାବୁଥିଲେ ଭାବୁଥିଲେ?
କିଛି ସେମିତି ଭାବନା ଆସୁନଥିଲା କାହିଁକି ନା ବ୍ରହ୍ମ ସାର୍ ବହୁତ ସପୋର୍ଟିଂ ମତେ କରିଛନ୍ତି ଆଉ ଷ୍ଟାଫ ବି ବହୁତ ସପୋର୍ଟିଂ କରିଛନ୍ତି ଆଉ ଆଇସିୟୁ ଭିତରେ ସବୁ ଷ୍ଟାଫ ବି ବହୁତ ହେଲ୍ପ କରିଛନ୍ତି ସମସ୍ତଙ୍କୁ ବହୁତ ଧନ୍ୟବାଦ।
ମେସେଜ କଣ ଦେବେ? ସୋସାଇଟିକୁ କଣ ଦେବେ? ଅର୍ଗାନ ଡୋନେସନ ପାଇଁ କିଛି କହିବେ?
ଲୋକଙ୍କୁ ଇଏ କହିବାକୁ ଚାହୁଁଛି ଯେ ମୁଁ ବହୁତ ଶୁଣିଛି ଲୋକ କହନ୍ତି କି